Welcome back to Woundcasters by Wound Care Today. I am your host, Felix Boecker, and today we're going to continue our deep dive into another Navy SEALs concept that is fundamental to our practice. You can't search trust. Now, I recently read The Wisdom of the Bullfrog by Admiral William McRaven. You may have seen his University of Texas commencement address in 2014, where he explains the power of making your bed every morning. In this book, he covers 18 important leadership lessons he learned in his time in the Navy SEALs. And upon reading this book, I felt the principles he talks about apply not just to the military special forces, but to us in chronic wound care as well. Now, trust is a resource you can build over time. It is not something you can just create in a moment of crisis. As medical professionals, we can no longer assume that we're automatically trusted just based on our degrees. Patients have more access to information than ever before and may have had negative past experiences and are rightly skeptical of a complex healthcare system. For these reasons, trust is not a given. It's a gift that you must earn every single day. Trust is built through the actions you take every day, how you show up for the work you do every day, how you show up in the interactions you have with other people every day. Today, we're going to explore how we must intentionally build trust not just with patients, but also every single person on our patient's care team. This includes the dedicated staff right here in our own clinic, the invaluable home health nurses who serve as our eyes and ears on the ground, and other specialties, from vascular to endocrinology to primary care, who refer their patients to us. Trust is the universal currency of effective healthcare. Building trust with our patients is the foundation of our work. Without it, even the best treatment plans will fail due to a lack of compliance. There are three important principles to keep in mind in order to earn trust with patients. So, number one, consistency and reliability. This starts with the most basic yet powerful act: showing up on time. Respecting your patient's time sends a clear message that their appointment is important to you. It's the first step in establishing a pattern of predictability and reliability. Perhaps this comes from my German roots, but I try my hardest to be ready at the appointed time for my patients. They took time out of their day at the appointed time to come see me, so I try to respect their time by being on time myself. That simple act alone helps build trust because it is well known that doctors are always late. So I make it a point to be on time, because this is the first step in building trust with patients. But this alone isn't enough. If you tell a patient you will call their home health agency to get a special dressing approved, you must do it. If you promise a referral to a podiatrist, make sure that referral is sent. Consistency builds a bedrock of reliability, showing your patient that you are an advocate who follows through on their promises. It's the small, predictable actions that accumulate into a large bank of trust. Number two, then, honesty and transparency. As wound care practitioners, we often have to deliver difficult truths. A wound might not be healing as expected, a new complication has occurred, or a treatment simply isn't working. Or maybe the patient's comorbidities are working against them. Instead of sidestepping these issues, we must communicate them clearly and compassionately. A trusting conversation might sound like this: Mr. Jones, based on the last few visits, we're not seeing the progress we had hoped for. Here's what that might mean, and here's the change I'd like to make to our plan. This approach frames honesty not as a failure, but as a path to collaboration. It shows your patient that you're a team working together with the patient to solve a problem. If I believe a particular wound will never heal, I will tell my patients, and I will tell them why. Maybe their diabetes is wildly out of control. Maybe their obesity limits mobility and any effects compression dressings may have on their lymphedema. Maybe there's cancer in the wound bed that is inadequately treated. Maybe they still smoke despite their vascular disease. By being open and honest in my communication with patients, I can create realistic expectations and build trust. Now, interestingly, this has never turned patients away from my care. Instead, they keep coming back to see me even if their wounds have no chance of ever healing. In communicating with patients, there's another aspect that must be considered as well. The healthcare system is complex and we speak a different language. Breaking things down into smaller chunks in simple language makes it easier for patients to understand what you're trying to achieve or communicate. Breaking things down into smaller chunks in simple to understand language shows you care about the patient. It shows you're not trying to hide anything, and that builds trust. Number 3, empathy and a holistic approach. A patient is not just a wound on a body. They're a person with a life, a family, and their own unique set of challenges. They have their own needs, wants, and desires. To build trust, you must demonstrate that you see them as a whole person. This means asking open-ended questions like, what does your day-to-day look like? Or are you able to follow the care plan at home? Or even, what are your biggest fears or concerns about this wound? Understanding a patient's life, whether they have a history of depression, financial limitations, or difficulty with mobility, allows you to create a care plan that is not just medically sound, but also realistic and compassionate. Being empathic in your approach again shows that you care about the patient and their unique situation. And that builds trust. Trust you can then build on to move a wound towards healing. But trust is not just important with patients if you really want to heal a wound. That relationship is critical, but it is not the only one. Effective wound care is a team sport, and we must be intentional about building trust with every player, whether they work in our clinic or not. Your clinic's nursing staff, medical assistants, and administrative support are the backbone of your practice. They're often the first and last person a patient sees. They are the ones who pick up the phones and do most of the communication with patients. Building trust with them is foundational. Treat your team as partners, not just as people who have a job to do. Encourage them to speak up if they have a concern or see something that doesn't look right. Their experience is invaluable. Acknowledge their hard work and expertise. A simple thank you builds immense goodwill. Be clear and direct in your communication with your staff. Now, don't just give an order. This is not the military. And even there, that doesn't work very well most of the time. You want to explain the why behind your treatment plan. When your team understands the rationale, they can better support the patient, answer their questions, and spot problems before they escalate. Your staff is human. Treat them with respect by explaining your rationale, and you build an incredible amount of trust. And trust needs to be established not only with our own clinic staff, but with the home health nurses as well. These professionals are our eyes and ears on the ground. They are the true experts on the patient's home environment, and their trust is not automatic. We must earn it. So how do we do that? This is much more difficult because we generally only interact with these fine people indirectly. So, number 1, respect their expertise. A home health nurse sees firsthand if a patient can physically reach their foot to apply a dressing, or if a patient's home has clean surfaces for dressing changes. These are important aspects of wound care which you cannot ascertain through a clinic visit. Patients spend way more time in their homes than they do in our clinics. If the home health nurses tell you a dressing isn't working because a patient's cat keeps pulling it off, or the patient's living situation makes clean techniques impossible, listen to them. They're not being difficult. They're giving you mission-critical data. Listening to them and respecting their invaluable input not only builds trust, but ultimately improves patient outcomes as well. Number 2, establish a clear communication loop. Don't just send orders. Provide a direct way for them to contact you with urgent questions and actively ask for their feedback. When a nurse provides feedback, acknowledge it and demonstrate that you've heard it by adjusting the care plan. This proves their observations directly influence the patient's care, empowering them and solidifying your partnership. In the end, it is the patient and their wound that stands to benefit from the trust that is earned with your home health nurses. Finally, the success of your wound clinic depends on a steady stream of referrals from other specialists. This relationship is a two-way street of professional trust. We need them to treat the many comorbidities our patients have, and they need us to maximize the potential for wound healing. So, number one, be a reliable partner. When a referring physician sends you a patient, you must communicate back to them promptly and thoroughly. Send a detailed consultation note outlining your findings, your treatment plan, and your expectations for the patient's care. Following up with periodic progress reports shows respect for their time and keeps them informed. This consistent communication builds confidence, assuring them that their patient is in good hands. You don't want to become a black hole where patients go and the referring physician never hear back from. Good communication builds trust between colleagues. Number two, demonstrate your competence. Consistently deliver excellent care and successful outcomes. When another physician sees a patient's wound heal under your care, their confidence in you grows, making them more likely to refer future patients. Your results are your best marketing tool. By showcasing your expertise through positive patient outcomes, you build a reputation that makes them more likely to refer future patients without hesitation. This seems obvious, but it is often overlooked. Now, sometimes you will encounter patients whose wounds are difficult or even impossible to heal. You can still build trust through open and honest communication with the referring provider, stating your reasons why you believe the wound cannot heal. Being open and honest in your communication can build trust even when the outcomes themselves cannot speak for you. And number three, position yourself as a resource. Don't wait for a referral to start a conversation. Be an accessible and collaborative partner. A quick, proactive call to a referring physician to ask for their input on a complex patient or to offer a consultation on a challenging case can build a powerful bond of professional respect. By positioning yourself as an expert resource, a peer can call on you for advice. You solidify your role in the care continuum and make them more invested in your shared success. This isn't meant to be a way to steal patients away from other physicians, but rather offering your expertise in the best interest of the patient. Now, finesse is key here, and this will take some practice to get right, but good communication is the cornerstone of building trust in any relationship. In the end, you can't search. Trust is a mantra for intentional practice. Trust is the currency of effective healthcare, and it is built through intentional actions, not assumed because of a title. It's how we ensure that when a crisis arises, we can act as a cohesive, high-performing team, just like the Navy SEALs. And we do so together because of trust. And with all that, thank you again for joining me on Woundcasters by Wound Care today. If there are any particular topics you want to hear about or guests you would like to see on the show, reach out and contact us. If you're listening to this on a podcast app, be sure to subscribe and leave us a 5-star review so others can find this content more easily. And if you like this particular episode, why not share it with a friend? As always, be sure to tune in next time as we explore another vital aspect of the challenging and rewarding field of chronic wound care. Ciao.